Good afternoon. I am Robin Grimm, Stoughton Town Manager, and I am here with a team of people today to provide an update for the community on the latest that we have on COVID-19, known as the coronavirus. Let me first have everybody introduce themselves.
I am Danielle Gallan. I am the Director of Health Services for Stoughton Public Schools.
Hi, I'm Dr. John Marcus. I'm the Superintendent of Schools.
I'm Janiece Bruce. I'm the Director of the Stoughton Public Health Association and Visiting Nurses.
I'm Donna, McNamara, the Police Chief.
So we wanted to get together today to talk to the town, provide some updates, share the information that we have, and let people know that we are concerned but not panicked. And as such, we are taking appropriate measures and establishing protocols, and just want you to know that you have a team of people that are working on your behalf, we are all in touch with our larger agencies, our state agencies, and we want to share whatever information we can. I'm going to now turn it over to Janiece to provide an update from the municipal operations side.
Hi. So as the Public Health Department and as the Director, it's my job to get information from the state and keep people updated as to what's going on from the Department of Public Health, and just assess the risks we have in town and what we're doing about it. Right now, of course, we are hearing so much on the news about coronavirus that I think it's important. We're hearing some things are rumors, then some things are facts, and some things are just evolving every day. So we want to make sure we're keeping up with the most current information. As a Department of Public Health Director, I go into a website every day by the Massachusetts Department of Public Health, and that keeps us informed of what's going on in the town of Stoughton. Right now, I've been in today, we don't have any active cases of coronavirus. We have had a few people that have had to quarantine because they were around somebody that had coronavirus, but right now we don't have any active cases. But if that were to occur, we would be following them and we would be giving them instructions as per the Department of Public Health regulations. But my bigger role, I think, is to help people in Stoughton realize what they can do for themselves. It's really some common sense measures that we've had all along during flu and cold seasons. This just seems, because the situation has just taken over so quickly, that we're just trying to remind people of some of the things we need to do, which would be things such as frequent hand washing, good hand washing, have hand sanitizer if you can't be near a sink after touching public spaces or hard surfaces where there are people, where other people have shared those surfaces. If you do have a cold, or if you have symptoms, stay home. Right now, we don't want to be bringing those into friends and neighbors' houses or public workspaces or anything like that. If you can help it, just stay home. Try to avoid touching your nose and your eyes and your mouth with your hands. People don't even think about it. They just do it kind of, it's just sort of a habit we have, so it might be more mindful. If you sneeze, sneeze into your elbow, don't sneeze into your hands, or if you use a tissue, wash your hands right after, throw the tissue away. So those are just things that we've always taught our kids, and it's kind of common sense. It's just we have to remind ourselves now to do it, disinfect surfaces. And I think another thing is we have to think about mental health, and right now a lot of people are very anxious, so I just wanted to just make a brief mention of that by being proactive and being informed in our town, we hope to be able to reduce some of the anxiety and just try to say, just don't put yourself in situations that may be overly crowded. Right now, this is, like I said, evolving. If you don't have to be in a public space with a lot of people, I would avoid it. And when you're home, don't get the facts, stay informed, but you might not want to listen to the news 24/7 and make yourselves anxious. Find some relaxation things that you can do. If you are having to be at home because you're not feeling well, try to get into something that's a little more relaxing, and try to keep your overall health healthy by eating well and getting enough fluids. Just try to keep yourself, as strong as you can. I'm sure I'm forgetting something, but that's just, I'm going to pass it along to other people now that want to say something.
So briefly, before I turn it over to Dr. Marcus, just so people know, in the town of Stoughton, we are on the municipal side canceling any large group events. So if you had an organization that was scheduled to have a meeting at our library, for example, that will be canceled. We are not hosting. Our reading groups in the library right now are canceled because those bring children from a multitude of places into one location, so it's harder to track things. Town meetings, planning meetings, finance committee meetings right now are still scheduled, and that really is under the purview of the individual chairs of those meetings. But again, what we're looking at is basically space in relationship to number of people at these, a density question. So we don't want 50 people in a room, or we don't want to encourage 50 people to be in a room. So we are taking that position. Our senior center, our Council on Aging is still open for lunch service, and Meals on Wheels service is still going out.
Right.
We still are running the buses. We're doing an extra sanitation job on those
Right.
buses. But again, we are making an effort not to run those with a full capacity of people. If a person has a doctor's appointment, we're happy to take them. But we would encourage people who do not have to ride the buses to stay home. They're simply still going to provide the service, however, because we know so many of our seniors need to get to doctor's offices. So again, we are canceling any major large-scale group activities in town, and again, just out of an abundance of caution. With that, I will turn it over to Dr. Marcus.
Thank you very much, Dr. Grimm. Good afternoon, good evening, everybody. I just wanted to say the Stoughton Public Schools are pleased to be working as a team to ensure that we are taking the best interest of our students, staff, and families into account as our number one priority. So safety first. I think that's really what we want to be clear with everybody, that our messaging is to make sure that we are taking safety as our number one priority. Our messages to kids are age appropriate and honest, and we're trying to be reassuring that kids are going to be okay and that we're going to do everything we can. As Janiece said, we've got lots of things in place in our schools to make sure that we're taking care of everybody, and we're going to continue to do that. So we want to make sure that folks know that we're taking care of our kids and giving them those proper messages. We're taking lots of precautions, and some of those, unfortunately, are cancellations. The precautions that we're taking are really to slow the spread of the virus. That's what it's all about. And so one of those, unfortunately, is that we're canceling various kinds of events where folks are going to be coming in. We're sending out a letter today to talk about some of those cancellations that include some of the bigger events like plays and other gatherings. So folks will see that, and we encourage you to go to our website, www.stoughtonschools.org, and right there we have a whole page devoted to the virus and information that folks can have about what's happening in the schools, any kinds of tightening of the openness of our events, the cleaning efforts that we have, the focus on hygiene, and trying to keep the communication open as much as we can. We're pleased to be able to have both local and state and federal partners. So we too are relying on Department of Public Health. We're also looking to Department of Education for their guidance, and we're also pleased to be working with our partners here in town. So I thank you for that. Our administrative team met this morning, and we've been working very hard on making sure that everything that we're doing is up to snuff and focused on safety. And one of our key partners in that is our Supervisor of Health Services, Danielle Gallan. So I was hoping that you could speak a little bit to what's happening in the schools.
Sure. Thank you very much for having me. I'm Danielle Gallan. I'm the Director of Health Services. I have been working very closely with Joyce Husseini, who is the Director of Facilities, reviewing the cleaning protocols, which we had started back in November at the beginning of flu season. I've also had the joy of working very closely with Janiece and the State Board of Health as well, with questions and concerns that may have arisen where we're working together as a team on what's the best scientific approach to take for our community. The nurses have been working diligently to teach students, staff, and parents about proper hand hygiene, cough hygiene, so right back to what Janiece had stated. And it's really just about working together as a team to support the health and wellness of our school and our town community.
Thanks, Danielle. And so we'll continue to be in touch as the schools stay abreast of our updates on our website and any other communications that we'll be sending out through email or phone calls as necessary. And as the situation is very fluid and changes rapidly these days, we have been trying to make sure that folks are informed as much as possible, even daily. So we'll keep it up. So thanks.
And we will turn it over to Chief McNamara.
Thank you. So if you call 911, you can expect that the emergency medical dispatch that answers the phone is going to ask a couple questions looking into signs and symptoms of what you may be calling for an ambulance for assistance. And they're going to ask you what your symptoms are, whether you have a fever. If you have a fever, has it been over 100 degrees, 0.4 Fahrenheit? If it has, they're going to then ask you if you've traveled outside of the country to specific locations like China, Italy, Iran, South Korea, or Japan. If the answers are yes to any of this, this is important information that the emergency medical dispatch is going to then transfer that information over to the responding paramedic firefighters from Stoughton Fire. We work closely with the Stoughton Fire Department and Chief Laracy, and we want to provide the precautions that are necessary so that the first responders responding to your location are in the best position to be protected with proper equipment personally so that they can continue to care for other people in our community.
Thank you. Thanks, Chief. And thanks to everybody. And just as a closing, right now we're looking probably at 31 March, these protocols in place, I would say at least till the end of March, given that we know there's pretty much a 14-day
Yes, that's true for the schools.
incubation. And I think the other thing that's important is I think I can speak for Dr. Marcus on this. We've had a lot of conversations in the past about the importance of communication.
Right.
And so, we will continue to keep you informed as the public. We don't believe in hiding. We want you to know everything we know, frankly, because we believe that kind of knowledge is power, not to use a cliche, but I think that's really important. And again, we are not panicked. We are concerned, but we are not panicking. And that's the message we want to get out. That's how we hope you all feel. And as Janiece said, your mental health is critical in all of this. The comfort of your children, not to be terrified, is a big part of this as well. So we will continue to update as we can. Continue to look at the school's website. Our website will have all the links to the Department of Health. My Stoughton Town Manager Facebook page will also provide updates as I have them. I believe we have another call possibly tomorrow afternoon is tentatively scheduled. And we will all keep everybody informed. If you have questions, check the websites. Again, if you have concerns that can't be answered on the websites, we don't want to flood phone lines. But if there is something very specific that you just don't know what to do about, call.
Yeah, we're happy to have folks give a call to central office or to any of the schools.
And one thing I might like to add is that if you do feel sick and you think you need to seek out medical attention, I would call your healthcare provider first, just so you can get directed as to where to go. If somebody was suspecting that they had symptoms of this type of virus, it's good to give people a heads up so that they can give you, tell you to the right spot, so that you're not just showing up at a CVS walk-in clinic or something like that, or a urgent care. That they want to know that you're coming so that they can give you special attention.
Well, Stoughton's a strong town.
Absolutely.
We have a great team throughout town here to serve you, and we will continue to serve you at our best and keep you informed. Thank you.
Thanks.
Thank you.
Thank you.